Hello, I'm Dr. Sophia Bennett, urologist and men's health specialist. If you're over 50 and feeling like you've lost your edge, less energy, decreased muscle mass, low libido, or that stubborn belly fat that won't budge, your testosterone might have crashed without you even realizing it. Here's what's alarming. 40% of men over 45 have clinically low testosterone, yet 90% don't even know it. They blame aging, stress, or just getting older, when their bodies are actually screaming for help. But here's the good news I'll share with you today. This isn't just inevitable aging, it's reversible, and I'm going to show you exactly how. Stay until the end because I'll reveal the 3 biggest testosterone killers hiding in your daily routine, plus the one morning habit that can boost your levels by 30% in just 8 weeks. And it's not what you think. Before we dive in, please subscribe to Dr. Sophia Bennett, Men's Health, hit that notification bell, and share this with any man who needs to hear this message. Your support helps me reach more men who desperately need this information. Let me tell you about James, a 52-year-old executive who came to my office convinced he was having a heart attack. His chest felt tight, he was exhausted despite sleeping 8 hours, and he'd gained 20 pounds around his midsection in 6 months. His blood pressure was fine, his heart was healthy, but his testosterone was at 180 nung-DL. That's lower than most 80-year-old men. This is the reality I see every single day in my practice. Men suffering in silence, accepting symptoms as normal aging, when they're actually experiencing testosterone deficiency syndrome. Here's what most men don't realize. Testosterone doesn't just affect your sex drive. It's your master hormone, controlling energy production, muscle maintenance, bone density, cognitive function, mood regulation, and even your cardiovascular health. When it crashes, your entire body systems begin to fail. The biggest mistake I see men make? Waiting years before seeking help. They tell themselves, I'm just getting older, while their quality of life deteriorates month by month. The warning signs your body is sending you right now. You need coffee to function, but still feel drained by 3 p.m. Your workouts feel harder, but you're seeing fewer results. You're irritable over small things that never bothered you before. Your belly is expanding despite eating the same way. You avoid intimate moments with your partner. You feel like you're losing your competitive edge at work. Here's the critical part. After age 30, testosterone naturally drops 1 to 2% per year. But after 50, this decline can accelerate dramatically. Environmental toxins, chronic stress, poor sleep, and modern lifestyle factors create what I call testosterone acceleration syndrome, where your levels can drop 5 to 10% annually instead of the normal 1 to 2%. But here's what will shock you. I've seen men in their 60s with higher testosterone levels than men in their 30s. The difference? They understood what was stealing their testosterone and took action to reverse it. Let me explain exactly what's happening inside your body after 50, because understanding this will change everything. Your testosterone production depends on a delicate communication system between your brain and your testicles. Your hypothalamus sends signals to your pituitary gland, which then tells your testicles to produce testosterone. After 50, this entire system starts breaking down. Here's the science. Your Leydig cells, the testosterone factories in your testicles, begin producing less testosterone. Simultaneously, your body increases production of sex hormone-binding globulin, SHBG, which binds to testosterone and makes it unavailable for use. It's like having less money while your expenses keep rising. But aging isn't the only culprit. Modern life is actively destroying your testosterone through what I call the testosterone thieves. The first thief is chronic stress and cortisol. When you're constantly stressed, your body produces cortisol, which directly suppresses testosterone production. Your body prioritizes survival over reproduction, so testosterone takes a backseat. The second thief is environmental estrogens. Plastics, pesticides, and chemicals in everyday products contain xenoestrogens that mimic estrogen in your body. These increase your estrogen levels while simultaneously lowering testosterone production. The third thief is insulin resistance. That expanding waistline isn't just cosmetic. It's metabolically active tissue that produces aromatase, an enzyme that converts testosterone into estrogen. The more belly fat you carry, the more testosterone you're converting into the hormone you don't want. The myth that's keeping men sick. Testosterone replacement therapy is dangerous. This outdated belief, based on flawed studies from the 1940s, has scared millions of men away from treatment. Modern bioidentical hormone therapy, when properly monitored, is not only safe but can be life-saving. Another dangerous myth. Low testosterone is just about sex. Wrong. Low testosterone increases your risk of heart disease by 40%, diabetes by 30%, and depression by 300%. It's not vanity. It's about your survival and quality of life. Here's what your doctor might not tell you. Many physicians receive minimal training in hormone optimization. They're taught to treat disease, not optimize health. A testosterone level of 300 ndl might be within normal range on paper, but it's nowhere near optimal for how you should feel and function. Now for the part you've been waiting for: how to reverse this decline and reclaim your vitality. First, when to seek help. If you're experiencing 3 or more symptoms I mentioned earlier, get tested. Don't wait for it to get worse. The optimal testosterone range for men over 50 is 600–1000 ndl, not the outdated normal range many labs use. The tests you need include not just total testosterone, but also free testosterone, estradiol, SHBG, LH and FSH, complete metabolic panel, vitamin D3, and B12 and folate levels. Now, the 3 strategies that work. The first strategy is the morning optimization protocol. This is the 30% boost I promised earlier. Every morning, within 1 hour of waking, get 15 minutes of direct sunlight exposure, do high-intensity movement for 7 minutes like burpees, sprints, or resistance training, and then cold exposure for 2 to 3 minutes through a cold shower or ice bath. This combination optimizes your circadian rhythm, triggers natural testosterone production, and reduces cortisol. My patients see measurable improvements in 6 to 8 weeks. The second strategy is the testosterone-supporting nutrition plan. Eat adequate healthy fats, 30–35% of calories from avocados, nuts, and olive oil. Include zinc-rich foods like oysters, beef, and pumpkin seeds. Consume cruciferous vegetables to support estrogen metabolism. Eliminate processed foods and reduce sugar intake drastically. The third strategy is strategic supplementation. Vitamin D3 at 4,000–6,000 IU daily. Magnesium glycinate 400–600 mg before bed. Zinc picolinate 15–30 mg daily. And quality omega-3s at 2–3 g daily. When lifestyle isn't enough, consider testosterone replacement therapy. Modern protocols using bioidentical hormones, when properly monitored by a specialist, can safely restore your levels to optimal ranges. This isn't about becoming superhuman, it's about feeling like yourself again. The monitoring that matters includes monthly blood work initially, then quarterly once optimized. We track not just testosterone levels, but estrogen, hematocrit, PSA, and overall health markers. Here's the encouraging truth. I've helped thousands of men over 50 reclaim their energy, strength, and vitality. The man who walks into my office feeling defeated often leaves 6 months later, feeling like he's in his 30s again. It's not magic. It's medicine applied correctly. Remember, gentlemen, low testosterone after 50 isn't inevitable, and it's definitely not something you have to accept. Your energy, strength, mental clarity, and vitality can be restored. The key is taking action now, not waiting until symptoms worsen. Every month you delay is another month of diminished quality of life. Thank you for trusting me with your health journey. If this video helped you understand what's happening in your body, please subscribe to Dr. Sophia Bennett. Men's Health. Give it a thumbs up and share it with men in your life who need this information. Here's my question for you. What was the first symptom that made you realize something was wrong with your energy levels? Share your story in the comments below. I read every single one and often respond personally. Remember, taking care of your testosterone isn't vanity. It's taking care of your health, your relationships, and your future. You deserve to feel strong and vital at every age. Until next time, stay healthy, stay strong.